Right, so if you have read and understood, considering it communication skills patient, can we begin?
Hello, Miss Alice. I'm Dr. Karma, one of the surgical doctors. I'm very sorry that you have been waiting too long to see Mr. Tom, your consultant, your husband's consultant.
Are you Mr. Man? Are you Mr. Man?
No, Miss, I am not Mr. Man. I'm very sorry that he has been called for an emergency, and I've been asked. I'm here to see
Okay,
what's
doctor.
wrong
Okay,
and
doctor. No
talk to
problem,
you.
doctor. Yes, we are waiting. I've been waiting. My husband is in serious distress right now.
Hello.
Hello, doctor. Hello, doctor.
Yes. Hello.
I think he's saying my husband.
We are waiting for the CT.
Yes.
Hello? Is it from my side or from him?
Yeah, I think yours.
From your side.
Yes, we couldn't hear you exactly.
Oh.
It's the network, that's all right, but his time is clicking. Here he got disconnected. Let's stop the timer. All right, if you can continue, that why do you need CT?
Yes, ma'am. First of all, let me tell you that he had tummy swelling, and we had to remove some of the fluids. And the study, the result of the fluid study showed that he had there is tumor cells in the fluid, but through CT we can know where is the tumor coming from, and what kind of the tumor it is, and how much it has spread.
Isn't there anything else we can do?
Yes, Miss. We have other alternatives. For temporary alternative, we can do ultrasound scan, which will give us an idea about his liver and any suspicious spots in his liver, and also it will give us an idea about the amount of the fluid in his tummy. And another alternative is an MRI scan, which is equally helpful as a CT scan. But for that, I need to ask Mr. Mann's opinion. And the last resort is we could transfer him to another hospital to do the scan.
All right. Why don't you do that then? Transfer.
I'm sorry, Miss. Usually, our hospital, we carry out investigations, routine investigation for such patients, and it usually takes 2 weeks period, and to transfer him to another hospital, it might. I also need to talk to Mr. Mann, and yes, I need
you have to say that this will leave him in more suffering, and it will begin his treatment from the beginning, and it will cause him more. It will not do any good to your own. Okay. Yes. So does my husband have cancer?
Miss, to say that he has cancer, we actually have to know where it is coming from, and what type of cancer it is, and how much it has spread. And for that, we need to do further investigations. Like we have already planned CT for him.
So can surgery be done if
he has cancer cells?
Cancer? Yes.
Since
what are the
your
treatment
husband's
options
fluid from the tummy showed,
yes.
Since your husband's fluid shows cancer cells, it gives us an impression that it might be an advanced cancer. So surgery in such patients may not be very helpful. It might give him more pain than more benefits. So for him, since we are thinking that it could be aggressive or advanced cancer, we might go for some palliative treatments.
Like what can you offer him? He's having so much difficulty with breathing, and his tummy is so swollen.
Yes, Miss, I understand. We can give him some painkillers, and for his tummy swelling, and since because of the swelling, he is having difficulty breathing because it is the swelling is pushing his lungs up. I can talk to Mr. Mann, and then remove some of the fluids which will relieve his swelling and also help him breathe better. And there are certain medications which can also decrease or remove fluids from his tummy.
Okay, so when are you going to do all this?
Yes, I'll get to Mr. Mann, and then we'll discuss. I'll discuss with him, and then plan, and it will be started as soon as possible.
Okay. Right. So at the end, you yes, to summarize.
Do you have any further queries?
Yes, I want him to get well soon. I can't see him like this.
We can understand, Miss. We are there to help your husband at any point of time, and we have already planned his investigations, his routine, his investigations and his treatments, and for his present conditions, we will prescribe him some medicines and all. And please don't hesitate to call us anytime. I'll leave my number with the nurse for you.
Okay, but you still had 44 seconds.
Please accept my sincerest apologies, and I'll also mention that you have come here. I'll mention to Mr. Mann that you have come here.
Yes, arrange also, another appointment.
Arrange another appointment with him.
Very good. Okay, and the tumor markers are pending, so reports have voted, so it's all right. 15, 16 seconds left. Okay, good. So who would give feedback to Dr. now? Yes, now you're back. Just give the feedback, please.
Okay, yes. Dr. Kama, well done. That was a good one. It was a good attempt. Ma'am, I felt we were quite...
yes, things to improve. Yes.
Yes. I think you are quite slow on him. I wanted to start by putting him off, as in really making him.
Yes, no, not
yeah.
I was cool with him because I know his exam is in May, not yet, so he has to learn.
Okay.
Yes,
okay.
So he's in learning phase. So we'll go slow with the people who are in learning phase. No aggressive bashing. Yes, but then give him feedback so that he can improve.
Okay. Basically, he answered most of the questions.
Yes.
He answered most of the questions you asked, and he also offered to get back to his consultant.
Yes.
During the process. I don't think there's any more.
Yes. When he was answering my question, when I asked if it's a cancer, then he had to answer more confidently that no, it's too early for us to conclude or to confirm, because there are so many tests that we have already sent and we are awaiting their results. We also want to plan this test because this is CTV you want to do, and this is why you want to do it, to stage. If it's cancer, then it is at what level. So here, in my opinion, you have to be very confident, and we had to handle the situation very aggressively that no, it's too early for us to say. Even if it is, then we have already sent so many tests and we are awaiting the result. And then that's why we want to do this CT scan to confirm the stage of the cancer. So these are the things that you had to, and then what are the other options of treatment? Like, that was like kind of my question. So that you told that you'll send the fluid and for analysis, and then when the result will come back, then you'll know if it's a cancer or not. And then if cancer is, I should have asked you if cancer is curable. I said if there is a surgery or management. So yeah.
Okay, ma'am.
Yeah, this one, yes, confidence. And whatever you say, you should put confidence in your tone, because you're the boss, you're the doctor. So whatever you'll say, patient or the relatives or attendants have to listen to you. So, and there's a strategy of telling as well. Yes, good. That you learn gradually. Will get you learn that. Yes, easily. Yes.
Okay.
Good. Thank you.
Thank you, ma'am.